My name is Dr. Amir. Chronic cough is a persistent cough that lasts 2 months or longer in adults. It is a symptom of an underlying health issue. Chronic cough can be bothersome and may affect the quality of life, causing sleep disturbances, vomiting, and even rib fractures in severe cases. Some important causes of chronic cough are from the respiratory system, like asthma, which often leads to cough, especially at night. Also, chronic bronchitis, so-called COPD, may be due to heavy smoking, which can cause persistent cough with mucus production. Another one is postnasal drip from excess mucus production from the sinuses, causing mucus dripping down to the back of the throat, triggering a cough as well. Another condition in the lungs is lung cancer, or tuberculosis, or pulmonary fibrosis. All can also lead to chronic cough. On the other hand, chronic cough can be triggered from the stomach, for example, acid reflux disease, or GERD, where the stomach acid flows up into the esophagus, irritating the throat and leading to a chronic cough, especially at night. Finally, certain medications like ACE inhibitors used for hypertension can cause chronic cough as a side effect. Treatment for chronic cough is directed at the underlying cause. For instance, antihistamines and decongestants may be prescribed for postnasal drip, inhaled cortisone for asthma, and PPI for acid reflux. If medications are the cause for the chronic cough, stopping the medication and using an alternative one may resolve it. Finally, chronic cough can be a frustrating condition, but with proper diagnosis and treatment, most underlying causes can be effectively managed, leading to significant improvement in the symptoms and the quality of life.